Dealing with nurse understaffing, intervention plan proposal. Applicable change or nursing theory utilized. The quality, mortality, and general conditions of patients are closely related to the performance of staff. Nurse understaffing poses a serious issue due to increased life expectancy, low birth rates, and an accelerating number of people who require medical assistance. Several strategic and theoretical approaches were conducted to reduce the shortage of staff. Implementing nursing theory in developing and structuring organizational procedures could be a critical entity in eliminating the understaffing problem. In addition, the issue requires complex investigation by managing the working schedule, enhancing the work satisfaction level, and improving the efficiency of nurses. Possible modifications in solving the problem of the staff deficit mainly include transformations in staffing tools, scheduling, frequency of rest breaks, and cost. Proposed implementation plan with outcome measures. The proposed plan examines many parameters in dealing with the understaffing of nurses and elevating their efficiency. The measures consist of scheduling with quick response methods, regulating nurses' turnover by regular rest breaks, and increasing the cost-effectiveness of the hospitals. A significant focus is directed to advanced planning, including control over patient flow and the quality of staff performance in a plan's implementation. The quick response method in managing schedules conducts the following goals: to communicate with patients and organizational units, to reduce the nurse's workload, and to assess effectiveness. This method allows to react and control nurses' management abilities daily. For example, a study administered by Schoenfelder et al. Revealed that the procedures related to overcrowding, red alerts, and emergencies become significantly organized. Moreover, the availability of information regarding current conditions and required actions allows for control of a working schedule. Overperforming and receiving undesired shifts is not surprising in the understaffing conditions. Nevertheless, quick response scheduling management provides information about nurses' availabilities, preferences, and wages, as well as data about the number of available beds and patient categories. An adequately designed time management system could reduce this problem. Another component of the proposed plan is introducing regular rest breaks for nurses. Understaffing is accomplished mainly by negative factors such as increased staff turnover produced by a high workload, reduced job satisfaction, and lack of communication with colleagues. Scheduled regular rest breaks are mandatory for all employers to provide an opportunity to recover and stress relief. In the European Union, such practice is necessary for working more than 6 hours per day. It helps not to drop psychological and emotional motivation as well as regain physical strain. In some situations, the shortage of personnel is explained by the poor financial conditions of the hospitals. This case requires cost-effective modeling to distribute finances properly. Griffiths et al. State that flexible staff deployment could be an efficient approach regarding employers' understaffing. This method demands the classification of patients according to their needs and assigning nurses based on their status, including temporary hiring or floating staff between units. Shifts administered by patient demands could help to maintain a flexible schedule. Evidence-based practice in creating the intervention plan. The plan is a combination of different strategies directed at the same issue of nurse understaffing. The problem of understaffing and its consequences mentioned in the study examined by Lully et al. Proves that effective schedule management could partially deal with this problem. The same study provided statistics that the hospitals annually lose 300 full-time equivalent nurses. In contrast, Wenche et al. Analyzed 80 German geriatric nursing teams. The results showed that regular rest breaks allow for controlling annual turnover and preventing predicted burnout among nurses. On the other hand, an economic modeling study conducted by Griffiths et al. Displayed that staffing plans with a more detailed dataset were more cost-effective. Flexible staff deployment was crucial in managing finances in the nurse scarcity conditions. Plan for evaluating the proposed nursing intervention. Implementation of the offered strategy requires a comprehensive course of action, including system analysis and educational sessions. The simplest solution to deal with the understaffing problem is to increase the number of employees. However, an increased number of nurses does not guarantee effective and organized work. Moreover, in some cases hiring new staff members is financially impossible. The proposed plan covers all possible considerations regarding this issue, including time management, cost-effectiveness, and productivity. This strategy suggests not only possible modifications in hospital operations but also considers the mental and physical health of healthcare workers. Identification of potential barriers and how to overcome them. Despite its positive sides, this approach has drawbacks as well. Firstly, the time scheduling of the nurse workforce is highly complicated because of the complex organizational levels and multi-phase planning. Moreover, the planning could vary based on geographical location and technologies implemented. Additionally, patient demand uncertainty must be considered to create a flexible schedule. Talking about regular rest breaks could be interrupted due to complications related to the patient's health. There are no significant barriers to the implementation of a cost-effective policy. However, the application of all methods is highly dependent on patients' categories and hospital departments.